Let's get you ready for the cosmetology exam with a focused review of essential concepts. In this video, we'll cover key topics like sanitation and safety, hair structure and chemistry, and the basics of skincare and nail services. And keep an eye on the bottom corner. There's something there that could give your prep a serious boost. Let's get started.
Safety and sanitation, infection control. Infection control principles, bacteria, viruses, fungi, parasites. What is the primary method of preventing the spread of bacterial infections in a salon environment? Is it A, using antibacterial hand sanitizer? B, regular hand washing with soap and water? C, wearing gloves at all times? Or D, disinfecting surfaces once a day? The answer is B, regular hand washing with soap and water. Hand washing is the most effective method to prevent the spread of infections. It removes bacteria and other pathogens that may be present on the skin, reducing transmission risk. What is the role of a disinfectant in infection control within a salon? Is it A, to kill or inactivate pathogens on surfaces? B, to sterilize all salon tools? C, to clean visible dirt and debris? Or D, to provide a pleasant fragrance? The answer is A, to kill or inactivate pathogens on surfaces. Disinfectants are used to kill or inactivate pathogens on surfaces, reducing the risk of infection transmission in the salon environment.
Have you noticed the code in the bottom corner? Next time you're stumped, take that code to birdsey.ai for immediate help and a free study session with Birdsey, your personal AI study partner. Plus, you'll get access to hundreds of additional questions, helping you move closer to passing your exam with confidence. The next time you're feeling unsure or stuck, give it a try.
Which of the following is a common viral infection that can be spread in salons? Is it A, ringworm, B, scabies, C, herpes simplex virus, or D, staphylococcus aureus? The answer is C, herpes simplex virus. Herpes simplex virus is a common viral infection that can be transmitted through direct contact, making it a concern in settings like salons. How can parasites be transmitted in a salon setting? Is it A, through the air, B, via contaminated tools, C, by touching clean surfaces, or D, through UV light exposure? The answer is B, via contaminated tools. Parasites can be transmitted through contaminated tools, which can harbor eggs or larvae. Proper sanitation and tool sterilization are crucial to prevent their spread. Disinfection and sterilization of tools, equipment, and surfaces. Which of the following is the most effective method for sterilizing metal tools used in cosmetology? Is it A, soaking in alcohol, B, ultraviolet light, C, autoclaving, or D, boiling in water? The answer is C, autoclaving. Autoclaving is considered the most effective sterilization method for metal tools as it uses high-pressure steam to kill all microorganisms, including spores, ensuring complete sterilization. What is the recommended contact time for disinfectants to effectively sanitize surfaces in a salon? Is it A, 5 minutes, B, 10 minutes, C, 15 minutes, or D, 1 minute? The answer is B, 10 minutes. Most disinfectants require a contact time of at least 10 minutes to effectively kill microorganisms. This allows the chemical to penetrate and eliminate pathogens properly. Which chemical is commonly used in salons for disinfecting non-porous surfaces and implements? Is it A, quaternary ammonium compounds, B, bleach, C, isopropyl alcohol, or D, hydrogen peroxide? The answer is A, quaternary ammonium compounds. Quaternary ammonium compounds, often referred to as quats, are widely used in salons for disinfecting non-porous surfaces due to their effectiveness and safety profile. What is the primary purpose of using a disinfectant on salon tools and surfaces? Is it A, to clean visible dirt and debris? B, to enhance the appearance of tools? C, to deodorize the salon environment? Or D, to kill microorganisms and prevent infection? The answer is D, to kill microorganisms and prevent infection. Disinfectants are used to eliminate most pathogenic microorganisms on salon tools and surfaces, reducing the risk of infection transmission among clients and staff. Which of the following statements about sterilization and disinfection is true? Is it A, sterilization removes all microbial life, disinfection reduces pathogens? B, disinfection is more thorough than sterilization? C, both processes are equally effective in eliminating spores? Or D, sterilization and disinfection are interchangeable terms? The answer is A, sterilization removes all microbial life, disinfection reduces pathogens. Sterilization completely removes all forms of microbial life, including spores, while disinfection reduces the number of pathogenic microorganisms to a safe level. Bloodborne pathogens and exposure protocols. What is the primary reason for using personal protective equipment when dealing with bloodborne pathogens? Is it A, to enhance comfort during procedures? B, to comply with fashion standards? C, to minimize exposure to infectious materials? Or D, to improve communication in the workplace? The answer is C, to minimize exposure to infectious materials. PPE acts as a barrier between the worker and infectious materials, reducing the risk of exposure to bloodborne pathogens. It is essential for maintaining safety in environments where exposure is possible. Which of the following is considered a bloodborne pathogen? Is it A, common cold virus? B, C, or D, chickenpox virus? The answer is B. Hepatitis B is a well-known bloodborne pathogen that can be transmitted through exposure to infectious blood or body fluids. It is critical to follow protocols to prevent infection. What is the first step to take if you experience a needle stick injury? Is it A, wash the area with soap and water? B, apply a bandage? C, notify your supervisor? Or D, seek medical attention? The answer is A, wash the area with soap and water. Immediately washing the area with soap and water helps reduce the risk of infection by removing potential pathogens. It is a critical first response to such injuries. How often should bloodborne pathogen training be conducted for employees in high-risk environments? Is it A, every 5 years? B, biannually? C, every 2 years? Or D, annually? The answer is D, annually. Annual training ensures that employees are up to date on protocols and safety measures, reducing the risk of exposure to bloodborne pathogens in their work environment. Which protocol should be followed when disposing of materials contaminated with blood? Is it A, place in regular trash bins? B, dispose of in biohazard containers? C, incinerate immediately? Or D, flush down the sink? The answer is B, dispose of in biohazard containers. Contaminated materials must be disposed of in biohazard containers to prevent the spread of infection and ensure compliance with safety regulations.
If you're finding this helpful, please take a minute to like this video and subscribe to our channel for more practice exams, useful tips, and complimentary study sessions with Birdsey.
Personal hygiene and client safety. What is the primary purpose of washing hands before and after each client service in a salon setting? Is it A, to remove germs and prevent infection? B, to improve the appearance of hands? C, to enhance the scent of products used? Or D, to comply with client preferences? The answer is A, to remove germs and prevent infection. Hand washing is crucial for removing germs and preventing the spread of infectious diseases. It helps protect both the client and the practitioner from potential infections, ensuring a safe environment. Why is it important to use disposable tools or properly sanitized reusable tools during client services? Is it A, to save time during services, B, to prevent cross-contamination and infection, C, to maintain tool quality and longevity, or D, to meet client expectations of professionalism? The answer is B, to prevent cross-contamination and infection. Using disposable or sanitized tools prevents cross-contamination and the spread of infections. It ensures that each client receives a safe service without exposure to pathogens from previous clients. What is the recommended action if a stylist accidentally cuts a client during a service? Is it A, continue the service without interruption, B, apologize and offer a discount on the service, C, stop the service, clean the wound, and apply a bandage, or D, ignore the cut if it is minor? The answer is C, stop the service, clean the wound, and apply a bandage. Immediately stop the service, apply first aid to the wound, and ensure it is properly cleaned and bandaged. This prevents infection and addresses the client's safety needs promptly. Why is it important to regularly clean and disinfect salon surfaces? Is it A, to enhance the salon's aesthetic appeal, B, to comply with local health regulations, C, to increase the lifespan of salon equipment, or D, to prevent the spread of pathogens and infections? The answer is D, to prevent the spread of pathogens and infections. Regular cleaning and disinfection of salon surfaces prevent the accumulation of pathogens, reducing the risk of infections and ensuring a safe and hygienic environment for clients and staff. How does wearing personal protective equipment contribute to client safety in a salon? Is it A, it acts as a barrier against infectious materials, B, it makes the practitioner appear more professional, C, it ensures compliance with fashion trends, or D, it reduces the need for frequent hand washing? The answer is A, it acts as a barrier against infectious materials. PPE, such as gloves and masks, provides a barrier against potentially infectious materials. It helps prevent the transmission of pathogens between the practitioner and the client, ensuring a safer service environment. OSHA regulations and material safety data sheets. What is the primary purpose of OSHA regulations in the workplace? Is it A, to increase workplace productivity, B, to reduce employee benefits, C, to ensure safe and healthful working conditions, or D, to manage employee attendance? The answer is C, to ensure safe and healthful working conditions. OSHA regulations are designed to ensure safe and healthful working conditions by setting and enforcing standards and providing training, outreach, education, and assistance. Which section of a material safety data sheet provides information on handling and storage? Is it A, first aid measures, B, handling and storage, C, exposure controls, personal protection, or D, physical and chemical properties? The answer is B, handling and storage. The handling and storage section of an MSDS provides guidelines on safe handling practices and conditions for safe storage, including incompatibilities. What does the term universal precautions refer to in infection control? Is it A, treating all blood and bodily fluids as potentially infectious, B, using gloves only when visibly contaminated, C, sanitizing equipment weekly, or D, avoiding contact with all clients? The answer is A, treating all blood and bodily fluids as potentially infectious. Universal precautions are infection control strategies that assume all human blood and bodily fluids are potentially infectious, thus requiring all to be treated as such to prevent disease transmission. What is the significance of the identification section in an MSDS? Is it A, lists the chemical's physical properties, B, describes first aid measures, C, outlines disposal considerations, or D, provides the chemical's name and emergency contact? The answer is D, provides the chemical's name and emergency contact. The identification section provides essential information about the chemical, including its common name, manufacturer, and emergency contact details, which are crucial for immediate reference.
Stuck on a question? Just think of the Birdsey link in the description as your friendly neighborhood superhero, swooping in to save the day with answers. Feel free to explore it now and return to continue. Simply hit pause, and we'll be waiting when you get back.
Hair care and services. Hair anatomy and physiology. What is the primary function of the cuticle layer in a hair strand? Is it A, to provide color to the hair, B, to supply nutrients to the hair, C, to protect the inner layers of the hair, or D, to control hair growth? The answer is C, to protect the inner layers of the hair. The cuticle is the outermost layer of the hair shaft, providing protection to the inner layers. It consists of overlapping cells that act as a barrier against environmental damage and help retain moisture. Which layer of the hair shaft is responsible for its strength and elasticity? Is it A, cuticle, B, C, medulla, or D, follicle? The answer is B, cortex. The cortex is the middle layer of the hair shaft, containing fibrous proteins and melanin. It provides strength, elasticity, and color to the hair, making it crucial for hair's structural integrity. What is the role of the sebaceous glands in hair physiology? Is it A, to produce sebum that lubricates the hair, B, to produce keratin for hair structure, C, to regulate hair growth cycles, or D, to provide nutrients to the hair shaft? The answer is A, to produce sebum that lubricates the hair. Sebaceous glands are small oil-producing glands present in the skin. They secrete sebum, an oily substance that lubricates the hair and skin, helping to maintain moisture and protect against external factors. Which part of the hair is primarily involved in the color of hair? Is it A, cuticle, B, medulla, C, follicle, or D? The answer is D. The cortex contains melanin, which determines the color of the hair. Variations in melanin type and concentration result in different hair colors. What is the role of keratin in hair structure? Is it A, to provide strength and structure to the hair, B, to control the moisture levels in hair, C, to produce sebum for hair lubrication, or D, to regulate the hair growth cycle? The answer is A, to provide strength and structure to the hair. Keratin is a fibrous protein that forms the primary structural component of hair. It provides strength and resilience, making hair durable and resistant to damage from physical and chemical stressors. Hair analysis, porosity, elasticity. What does high porosity in hair indicate? Is it A, the hair is resistant to moisture, B, the hair has a smooth cuticle layer, C, the hair absorbs moisture quickly but loses it just as fast, or D, the hair requires less conditioning? The answer is C, the hair absorbs moisture quickly but loses it just as fast. High porosity means the hair cuticle is raised, allowing moisture to enter and escape easily. This can lead to dryness and frizz, requiring products that lock in moisture. Which hair texture is most likely to be affected by humidity? Is it A, low porosity hair, B, coarse high porosity hair, C, medium normal porosity hair, or D, fine high porosity hair? The answer is B, coarse high porosity hair. Coarse hair with a high porosity is more susceptible to humidity because its raised cuticle allows moisture from the air to penetrate easily, leading to frizz. How is hair elasticity tested? Is it A, by stretching a wet strand of hair and observing its return to original length? B, by measuring the hair's thickness? C, by checking the hair's response to heat styling? Or D, by observing the hair's shine? The answer is A, by stretching a wet strand of hair and observing its return to original length. Hair elasticity is tested by stretching a strand of wet hair. Healthy hair should stretch and return to its original length without breaking, indicating good elasticity. What characteristic is typical of low porosity hair? Is it A, hair dries quickly after washing? B, hair feels oily and greasy? C, hair tangles easily? Or D, hair resists moisture and takes longer to dry? The answer is D, hair resists moisture and takes longer to dry. Low porosity hair has tightly closed cuticles, making it resistant to moisture absorption. This often requires heat or steam to effectively penetrate hair products. Hair cutting techniques: scissors, razors, clippers. What is the primary advantage of using scissors over clippers for hair cutting? Is it A, quicker cutting time? B, greater precision and control? C, better for cutting thick hair? Or D, easier to learn for beginners? The answer is B, greater precision and control. Scissors allow for precise control and detail work, which is essential for creating intricate styles and textured looks. Clippers are better suited for uniform cuts and speed. Which hair cutting technique involves holding the hair at a 90-degree angle from the head? Is it A, layering? B, blunt cutting? C, point cutting? Or D, tapering? The answer is A, layering. The 90-degree angle technique is used in layered cuts to create uniform layers throughout the hair, achieving volume and movement. Why might a stylist choose a razor over scissors for cutting hair? Is it A, to achieve a blunt finish? B, to cut hair faster? C, to create a softer, textured look? Or D, to improve hair growth? The answer is C, to create a softer, textured look. Razors create a softer, more feathered look, which is ideal for adding texture and reducing bulk in fine hair, unlike scissors, which give a more structured cut. What is the effect of using clippers with a guard on hair length? Is it A, creates uneven layers? B, adds texture? C, thins the hair? Or D, maintains consistent hair length? The answer is D, maintains consistent hair length. Using clippers with a guard ensures that the hair is cut to a consistent length, as the guard controls the distance between the clipper blades and the scalp. When is point cutting most effectively used in hair cutting? Is it A, for creating geometric shapes? B, to add texture and soften edges? C, to create blunt cuts? Or D, to increase volume? The answer is B, to add texture and soften edges. Point cutting is best used to soften the ends of the hair and add texture, which helps in blending layers and removing bulk without altering the overall length.
If you're finding this helpful, please take a minute to like this video and subscribe to our channel for more practice exams, useful tips, and complimentary study sessions with Birdsey.
Hairstyling, blow drying, thermal styling, braiding, updos. What is the primary purpose of using a diffuser attachment when blow drying curly hair? Is it A, to maintain natural curl pattern and reduce frizz? B, to straighten the hair while blow drying? C, to increase the speed of drying? Or D, to add more shine to the hair? The answer is A, to maintain natural curl pattern and reduce frizz. A diffuser attachment is designed to disperse air evenly, which helps to maintain the natural curl pattern and reduces frizz. This is essential for achieving a more defined and voluminous curly hairstyle. Which tool is best suited for creating tight curls in thermal styling? Is it A, large barrel curling iron, B, small barrel curling iron, C, flat iron, or D, blow dryer with a round brush? The answer is B, small barrel curling iron. A small barrel curling iron is ideal for creating tight curls. The smaller diameter allows the hair to wrap around more times, resulting in tighter, more defined curls compared to larger barrels. When creating a French braid, what is the key technique that distinguishes it from a regular braid? Is it A, using 3 sections of hair, B, braiding tightly for a neat finish, C, starting the braid at the nape of the neck, or D, adding sections of hair gradually? The answer is D, adding sections of hair gradually. A French braid involves gradually adding sections of hair into the main braid as you work down the head. This technique creates a braid that is integrated into the scalp, unlike a regular braid. Hair coloring, semi-permanent, permanent, bleaching. What is the primary difference between semi-permanent and permanent hair color? Is it A, semi-permanent color lasts longer than permanent color, B, permanent color is easier to remove than semi-permanent color, C, semi-permanent color does not penetrate the hair cortex, or D, both types of color require the use of a developer? The answer is C, semi-permanent color does not penetrate the hair cortex. Semi-permanent hair color coats the hair shaft without altering natural pigment, while permanent color penetrates the cortex and changes the hair's natural pigment through oxidation. Which of the following is a key benefit of using a semi-permanent hair color? Is it A, it is less damaging to the hair, B, it permanently alters the hair's natural pigment, C, it requires a higher concentration of developer, or D, it can lighten the hair by several shades? The answer is A, it is less damaging to the hair. Semi-permanent hair color is less damaging because it does not contain ammonia or require a developer, making it gentler on the hair while providing temporary color. Why is it important to perform a patch test before applying hair color? Is it A, to test the final hair color result, B, to prevent allergic reactions, C, to ensure even color distribution, or D, to enhance the color's longevity? The answer is B, to prevent allergic reactions. A patch test is essential to check for allergic reactions to hair dye ingredients, as these reactions can cause skin irritation or more severe health issues. Chemical texture services, perms, relaxers, keratin treatments. What is the primary function of a neutralizer in a perm process? Is it A, to soften the hair, B, to re-harden the hair structure, C, to add moisture to the hair, or D, to increase hair elasticity? The answer is B, to re-harden the hair structure. A neutralizer re-hardens the hair structure after it has been softened by the perm solution. This step is crucial for setting the new curl pattern and ensuring the perm lasts. Which of the following is a key benefit of keratin treatments? Is it A, reduces frizz and smooths hair, B, permanently straightens hair, C, adds volume to hair, or D, lightens hair color? The answer is A, reduces frizz and smooths hair. Keratin treatments primarily aim to reduce frizz and smooth the hair. They temporarily alter the hair's protein structure, making it more manageable and shiny. What is the main purpose of a relaxer in hair care? Is it A, to add curls to straight hair, B, to enhance natural waves, C, to permanently straighten curly hair, or D, to condition the hair deeply? The answer is C, to permanently straighten curly hair. Relaxers are used to permanently straighten curly or tightly coiled hair by breaking down the protein structure, allowing it to be reshaped. This process is irreversible until new hair grows. Shampooing, conditioning, and scalp care. What is the primary purpose of using a clarifying shampoo? Is it A, to add moisture to dry hair? B, to remove product buildup and impurities? C, to enhance hair color? Or D, to increase hair volume? The answer is B, to remove product buildup and impurities. Clarifying shampoos are designed to remove product buildup, excess oils, and impurities from the hair and scalp. They are typically used once a week or as needed to maintain a healthy scalp environment. Which condition can be improved by using a scalp treatment with tea tree oil? Is it A, split ends, B, hair loss, C, dandruff, or D, frizz? The answer is C, dandruff. Tea tree oil has natural antifungal and antibacterial properties, making it effective in treating dandruff and maintaining a healthy scalp. It helps reduce flakiness and soothe irritation. How often should a deep conditioning treatment be applied for optimal hair health? Is it A, once a week, B, daily, C, once a month, or D, every 6 months? The answer is A, once a week. Deep conditioning treatments are recommended once a week to restore moisture, strengthen hair, and improve elasticity. Overuse can lead to product buildup and weigh hair down. Skin care and services. Skin anatomy and physiology. Which layer of the skin is primarily responsible for the production of new skin cells? Is it A, basal layer, B, stratum corneum, C, or D, subcutaneous layer? The answer is A, basal layer. The basal layer, part of the epidermis, is crucial for generating new skin cells. It contains basal cells that continuously divide, pushing older cells toward the surface. What is the primary function of melanin in the skin? Is it A, to regulate temperature, B, to protect against UV radiation, C, to provide hydration, or D, to produce sebum? The answer is B, to protect against UV radiation. Melanin is a pigment produced by melanocytes, providing skin color and protecting against UV radiation by absorbing harmful rays and preventing DNA damage. Which component of the dermis is primarily responsible for skin elasticity? Is it A, collagen, B, keratin, C, elastin, or D, hyaluronic acid? The answer is C, elastin. Elastin fibers in the dermis provide the skin with its elastic quality, allowing it to return to its original shape after stretching or contracting.
Don't forget to comment below with your tips, challenges, and thoughts on exam preparation. Your experiences can make a big difference for others.
Skin analysis and conditions. Which skin type is characterized by larger pores and a shiny appearance, often requiring frequent cleansing? Is it A, dry skin, B, skin, C, combination skin, or D, sensitive skin? The answer is B, oily skin. Oily skin is characterized by larger pores and a shiny appearance due to excess sebum production. It often requires frequent cleansing to manage oil levels and prevent acne. What is a common characteristic of mature skin? Is it A, loss of elasticity, B, excess oil production, C, frequent breakouts, or D, even skin tone? The answer is A, loss of elasticity. Mature skin is often characterized by a loss of elasticity and firmness due to a decrease in collagen and elastin production, leading to sagging and the appearance of wrinkles. Which skin condition is characterized by red, inflamed patches and is often triggered by stress or harsh skincare products? Is it A, B, psoriasis, C, eczema, or D, acne? The answer is C, eczema. Eczema, also known as atopic dermatitis, is characterized by red, inflamed patches that can be triggered by stress, allergens, or harsh skincare products. Facial treatments, cleansing, masks, massage. What is the primary purpose of a facial cleansing treatment in skincare? Is it A, to remove dirt and impurities from the skin, B, to exfoliate dead skin cells, C, to provide deep hydration, or D, to stimulate collagen production? The answer is A, to remove dirt and impurities from the skin. Facial cleansing is essential for removing dirt, oil, and impurities from the skin, which helps maintain a healthy complexion and prepares the skin for further treatments. Which type of facial mask is best suited for oily skin? Is it A, gel mask, B, clay mask, C, cream masks, or D, sheet masks? The answer is B, clay masks. Clay masks are ideal for oily skin as they absorb excess oil and help unclog pores, improving the skin's overall texture and appearance. What is the main benefit of facial massage during a treatment? Is it A, to exfoliate the skin, B, to deeply cleanse the pores, C, to improve blood circulation, or D, to remove facial hair? The answer is C, to improve blood circulation. Facial massage improves blood circulation, which enhances skin tone and texture, promotes relaxation, and can aid in the absorption of skincare products. Hair removal, waxing, tweezing. What is the primary reason for avoiding waxing on skin that is sunburned? Is it A, it will not remove hair effectively, B, it can cause further skin irritation and damage, C, it increases the risk of infection, or D, it may cause the wax to not adhere properly? The answer is B, it can cause further skin irritation and damage. Waxing on sunburned skin can cause severe irritation and damage because the skin is already compromised. It's important to allow the skin to heal before undergoing a waxing procedure. Which of the following is a contraindication for tweezing? Is it A, oily skin, B, dry skin, C, eczema, or D, freckles? The answer is C, eczema. Skin conditions such as eczema can be exacerbated by tweezing, leading to increased irritation and potential infection. It's crucial to avoid tweezing until the condition improves. Why is it important to apply pressure immediately after removing a wax strip? Is it A, to soothe the skin and reduce pain, B, to ensure all hair is removed, C, to prevent wax residue from sticking, or D, to close the hair follicle? The answer is A, to soothe the skin and reduce pain. Applying pressure helps to soothe the skin and reduce the sensation of pain by temporarily numbing the nerve endings. This technique is essential for client comfort during waxing. Makeup application basics. What is the primary purpose of using a primer before applying foundation? Is it A, to add color to the skin, B, to create a smooth surface for makeup, C, to cleanse the skin, or D, to moisturize the skin? The answer is B, to create a smooth surface for makeup. Primer creates a smooth surface for makeup application, helping foundation adhere better and last longer. It can also minimize the appearance of pores and fine lines. Which tool is most effective for applying liquid foundation for a flawless finish? Is it A, beauty sponge, B, powder puff, C, fan brush, or D, eyeliner brush? The answer is A, beauty sponge. A beauty sponge is effective for applying liquid foundation as it helps blend the product seamlessly into the skin, providing a natural and even finish. What is the recommended technique for applying concealer to cover blemishes effectively? Is it A, swiping, B, brushing, C, dabbing, or D, rubbing? The answer is C, dabbing. Dabbing concealer onto blemishes provides better coverage and prevents the product from being wiped away, ensuring it stays in place for longer-lasting coverage. Nail care and services. Nail anatomy and disorders. Which part of the nail is responsible for its growth? Is it A, matrix, B, lunula, C, nail bed, or D, cuticle? The answer is A, matrix. The matrix is the tissue under the nail that produces cells that become the nail plate. It is essential for nail growth as it continuously generates new cells that push the old ones forward. What condition is characterized by a fungal infection of the nail? Is it A, paronychia, B, onycholysis, C, onychosis, or D, leukonychia? The answer is C, onychosis. Onychomycosis, also known as tinea unguium, is a common fungal infection of the nail. It leads to discoloration, thickening, and separation of the nail from the nail bed. What is the visible part of the nail that rests on the nail bed called? Is it A, nail matrix, B, nail plate, C, hyponychium, or D, eponychium? The answer is B, nail plate. The nail plate is the hard part of the nail that is visible and rests on the nail bed. It is composed of keratinized cells and provides protection to the underlying structures. Manicure and pedicure procedures. What is the primary purpose of soaking hands in water during a manicure? Is it A, to clean the nails thoroughly, B, to soften the cuticles, C, to disinfect the nails, or D, to remove nail polish? The answer is B, to soften the cuticles. Soaking hands in water softens the cuticles, making it easier to push them back or remove them. This step is crucial for preparing the nails for further treatment. Which tool is essential for trimming cuticles during a manicure? Is it A, cuticle nipper, B, nail file, C, buffer block, or D, pumice stone? The answer is A, cuticle nipper. A cuticle nipper is specifically designed to trim excess cuticle and hangnails. It provides precision and control, essential for maintaining nail health. What is the main benefit of using a base coat in a manicure? Is it A, to add shine to the nails, B, to speed up drying time, C, to prevent nail staining, or D, to strengthen the nails? The answer is C, to prevent nail staining. A base coat provides a protective layer that prevents nail polish from staining the nails. It also helps polish adhere better, prolonging the life of the manicure. Nail enhancements, acrylics, gels, wraps. What is the primary purpose of using a nail primer before applying acrylic enhancements? Is it A, to add color to the nail, B, to improve adhesion of the acrylic, C, to protect the nail from UV light, or D, to speed up the drying process? The answer is B, to improve adhesion of the acrylic. Nail primer is used to prepare the natural nail surface by removing oils and moisture, ensuring that the acrylic adheres properly. This step is crucial for the longevity and durability of the enhancement. Which type of nail enhancement is typically cured under a UV or LED light? Is it A, gel, B, acrylic, C, wraps, or D, silk? The answer is A, gel. Gel enhancements require curing under a UV or LED light to harden and set properly. This process is essential for achieving the desired durability and finish. What is the main advantage of silk wraps over other nail enhancements? Is it A, greater durability, B, faster application time, C, natural appearance and flexibility, or D, stronger adhesion? The answer is C, natural appearance and flexibility. Silk wraps are known for their natural appearance and flexibility. They are ideal for clients who prefer a less bulky look and need reinforcement for natural nails.
Notice the code in the corner? When you're stumped by a question, enter it at birdsey.ai for immediate help. Enjoy complimentary study sessions and access to hundreds of additional questions to help you pass your exam with confidence.
Sanitation for nail services. What is the most effective method to sanitize metal nail tools between clients? Is it A, soaking in alcohol, B, autoclaving, C, rinsing with hot water, or D, wiping with a disinfectant cloth? The answer is B, autoclaving. Autoclaving is the most effective method for sanitizing metal nail tools as it uses high-pressure steam to eliminate bacteria, viruses, and spores, ensuring thorough sterilization. Why is it important to use disposable buffers and files in nail services? Is it A, to prevent cross-contamination, B, they are cheaper than reusable tools, C, they are more durable, or D, to enhance the aesthetic of the salon? The answer is A, to prevent cross-contamination. Disposable buffers and files prevent cross-contamination between clients as they are used once and discarded, reducing the risk of spreading infections. What should be done with nail clippings after a manicure service? Is it A, left on the workstation, B, flushed down the sink, C, disposed of in a sealed trash bin, or D, stored for future analysis? The answer is C, disposed of in a sealed trash bin. Nail clippings should be disposed of in a sealed trash bin to prevent any risk of infection and maintain a clean environment in the salon. Chemical procedures. Chemistry of hair color and chemical relaxers. What is the primary function of ammonia in hair color formulations? Is it A, neutralizes pH, B, acts as a conditioner, C, opens the hair cuticle, or D, adds shine to hair? The answer is C, opens the hair cuticle. Ammonia opens the hair cuticle, allowing color molecules to penetrate the cortex. This process is essential for permanent color changes. Without ammonia, the color would not effectively enter the hair shaft. Which chemical is commonly used in hair relaxers to break disulfide bonds? Is it A, sodium hydroxide, B, hydrogen peroxide, C, ammonium thioglycolate, or D, lactic acid? The answer is A, sodium hydroxide. Sodium hydroxide is a strong alkali used in chemical relaxers to break disulfide bonds in hair. This process straightens curly hair by altering its internal structure. What role does hydrogen peroxide play in hair coloring? Is it A, acts as a bleaching agent, B, oxidizes color molecules, C, neutralizes ammonia, or D, seals the hair cuticle? The answer is B, oxidizes color molecules. Hydrogen peroxide acts as a developer in hair coloring, oxidizing the color molecules and helping them bond with the hair. It also lightens natural hair color by breaking down melanin. Safety precautions for chemical applications. What is the first step you should take if a chemical spill occurs in a salon setting? Is it A, assess the situation and wear protective equipment, B, immediately clean the spill with water, C, call emergency services, or D, ventilate the area? The answer is A, assess the situation and wear protective equipment. The first step in handling a chemical spill is to assess the situation and ensure personal safety. This includes wearing appropriate protective equipment to prevent exposure to harmful substances. Which of the following is a key reason for storing chemicals in their original containers? Is it A, to prevent evaporation, B, to ensure proper labeling and safety instructions, C, to maintain the chemical's effectiveness, or D, to avoid contamination? The answer is B, to ensure proper labeling and safety instructions. Storing chemicals in their original containers ensures that all safety and handling instructions are readily available, reducing the risk of misuse or accidental exposure. Why is it important to have an eye wash station in a salon where chemical applications are performed? Is it A, to clean tools and equipment, B, to wash hands after chemical use, C, to provide immediate decontamination for eyes, or D, to improve salon hygiene? The answer is C, to provide immediate decontamination for eyes. An eye wash station provides immediate decontamination for eyes exposed to chemicals, which is crucial in preventing long-term damage or irritation. pH scale and product interactions. What is the pH range of human skin, and why is it important to consider this when selecting skincare products? Is it A, 4.5 to 5.5, B, 7 to 8, C, 2 to 3, or D, 8 to 9? The answer is A, 4.5 to 5.5. Human skin typically has a pH range of 4.5 to 5.5. Maintaining this acidic environment is crucial for protecting against harmful bacteria and maintaining moisture balance. Which of the following pH levels would indicate an alkaline shampoo, and what effect might this have on hair? Is it A, 4.5, B, 5.5, C, 6.5, or D, 8.5? The answer is D, 8.5. An alkaline shampoo with a pH above 7 can open the hair cuticle, which may lead to increased frizz and damage over time. Why is it important for a conditioner to have a slightly acidic pH, and what benefits does this provide? Is it A, to increase hair volume, B, to close the hair cuticle, C, to strip oils from the scalp, or D, to neutralize hair color? The answer is B, to close the hair cuticle. A slightly acidic pH helps to close the hair cuticle, which can enhance shine and smoothness while also protecting against environmental damage. Patch testing and client consultations. What is the primary purpose of conducting a patch test before a chemical procedure? Is it A, to determine hair texture, B, to check for allergic reactions, C, to evaluate product effectiveness, or D, to measure pH levels of the product? The answer is B, to check for allergic reactions. A patch test is conducted to assess the client's skin sensitivity and potential allergic reaction to the chemical products used. This helps prevent adverse reactions during the procedure. How long should a patch test be observed for any adverse reactions? Is it A, 1 to 2 hours, B, 12 hours, C, 24 to 48 hours, or D, 72 hours? The answer is C, 24 to 48 hours. A patch test should be observed for 24 to 48 hours to accurately identify any delayed allergic reactions, ensuring client safety before proceeding with the full treatment. During a client consultation, what is a crucial step to ensure an effective patch test? Is it A, discuss styling preferences, B, evaluate hair length, C, choose hair color, or D, review medical history? The answer is D, review medical history. Obtaining the client's complete medical history, including allergies and past reactions, is crucial. This information helps tailor the patch test and anticipate potential issues. Salon operations and professional practices. Client consultation and documentation. What is the primary purpose of a client consultation in a salon setting? Is it A, to upsell additional services, B, to understand the client's needs and expectations, C, to determine the client's budget, or D, to confirm the client's appointment? The answer is B, to understand the client's needs and expectations. The primary purpose of a client consultation is to understand the client's needs and expectations, ensuring that the service provided meets their desires and any specific requirements they may have. Which document is essential to complete during the initial client consultation? Is it A, client intake form, B, appointment confirmation slip, C. Service menu, or D. Payment receipt? The answer is A. Client intake form. The client intake form is crucial as it gathers personal information, medical history, and specific needs, which helps in tailoring the service to the client's requirements. Why is it important to discuss a client's lifestyle during a consultation? Is it A. To determine the client's budget, B. To decide on product recommendations, C. To tailor the service to be practical and maintainable, or D. To schedule future appointments? The answer is C. To tailor the service to be practical and maintainable. Understanding a client's lifestyle helps tailor services that are practical and maintainable for the client, ensuring satisfaction and long-term results. Salon business management, inventory scheduling. What is the primary benefit of using a computerized scheduling system in a salon? Is it A. It reduces the need for staff, B. It minimizes human error, C. It increases inventory turnover, or D. It lowers operational costs significantly? The answer is B. It minimizes human error. A computerized scheduling system improves efficiency by reducing human error, ensuring accurate bookings, and optimizing time management. This leads to better customer satisfaction and increased salon productivity. Which inventory management practice is most effective for a salon to avoid overstocking products? Is it A. Annual inventory checks, B. Bulk purchasing, C. Just-in-time ordering, or D. Seasonal sales forecasting? The answer is C. Just-in-time ordering. Just-in-time inventory management ensures that products are ordered and received only as needed. This reduces the risk of overstocking and minimizes storage costs. How can a salon effectively manage no-shows and last-minute cancellations? Is it A. Implement a cancellation policy with fees, B. Overbook appointments, C. Offer discounts for rescheduling, or D. Extend salon hours? The answer is A. Implement a cancellation policy with fees. Implementing a cancellation policy with fees can deter clients from canceling last minute and encourages them to notify the salon in advance, allowing for better schedule management. Professional ethics and communication. What is the most ethical way to handle a client's dissatisfaction with a service? Is it A. Ignore the complaint and proceed with the next client, B. Blame the client for their dissatisfaction, C. Listen to the complaint, empathize, and offer a solution, or D. Offer a discount on future services without addressing the complaint? The answer is C. Listen to the complaint, empathize, and offer a solution. Addressing a client's dissatisfaction requires active listening, empathy, and a willingness to find a resolution. This approach fosters trust and demonstrates professionalism, ensuring the client feels valued and respected. Why is confidentiality important in salon operations? Is it A. To build trust and ensure client privacy, B. To increase sales through client referrals, C. To avoid legal issues with competitors, or D. To maintain a competitive edge in marketing? The answer is A. To build trust and ensure client privacy. Confidentiality builds trust between clients and salon professionals, ensuring that personal and sensitive information shared during services is protected, fostering a safe and respectful environment. How should a salon professional handle a situation where a client requests a service that is not possible due to safety concerns? Is it A. Perform the service to satisfy the client, B. Explain the safety concerns and suggest alternatives, C. Refer the client to another salon, or D. Ignore the request and continue with a different service? The answer is B. Explain the safety concerns and suggest alternatives. Professionals must prioritize safety and explain why a service cannot be performed, offering alternatives that meet the client's needs while ensuring their safety and well-being. First aid in the salon. What is the first step you should take if a client suffers a minor cut in the salon? Is it A, clean the wound with soap and water? B, apply a bandage immediately? C, call emergency services? Or D, apply an antiseptic cream? The answer is A, clean the wound with soap and water. The first step in treating a minor cut is to clean the wound with soap and water to prevent infection. This is a standard practice in first aid to ensure the area is free from contaminants. Which of the following is not an appropriate step in treating a chemical burn in the salon? Is it A, rinse the affected area with cool water? B, remove any contaminated clothing? C, seek medical attention if necessary? Or D, apply ointment or cream to the burn? The answer is D, apply ointment or cream to the burn. In case of a chemical burn, you should not apply ointments or creams. The focus should be on rinsing the area thoroughly with water to remove the chemical. When performing first aid for a client who has fainted in the salon, what is the recommended position to place them in? Is it A, sitting up straight? B, lying on their stomach? C, lying on their back with legs elevated? Or D, standing up slowly? The answer is C, lying on their back with legs elevated. Placing a fainted person in a supine position with their legs elevated helps improve blood flow to the brain, which can aid in their recovery.
Thanks for joining us today. If you found this video helpful, subscribe to our channel for more practice exams, tips, and tricks. And don't forget to visit birdsey.ai for complimentary study sessions with Birdsey, your AI-powered study partner.